Hello, I'm Dina Jackway, Parkview's Chief Administrative Officer, and welcome to another episode of Parkview Connections. It's a podcast geared to help Parkview coworkers connect, learn, and grow. Our goal is to inspire leadership and influence, and meet coworkers and leaders and hear stories of bold leadership that engage and encourage us, and really help shape this wonderful excellence culture that we have here at Parkview. So before we get started, I just want to say a big thank you for the great comments from our first episode with our Parkview Health Board Chair, Dan Starr. So I appreciated the comments online and via email about the impact that Dan's story had. And certainly the story of his father and that care was wonderful. Appreciated also the suggestions that some of you sent to what future guests and topics you'd like to see, so keep them coming. So for this episode of Parkview Connections, I'm excited to have with us Tammy Briggle, who's our Public Relations Manager. Welcome.
Thanks for having me.
So you've been with Parkview about 3.5 years.
Yes.
Which I have to tell you, when I saw that, I was like, it feels like she's been here a whole lot longer. But That's the COVID in there. I mean, that probably felt like double the time.
Exactly.
Yes. And so this is also a little fun for me because usually you're not on camera. It's you coaching me or coaching other leaders to give statements. And so it's kind of fun actually to have you then on camera.
It's fun, but also very intimidating. I give people advice all the time on interviews and ways to prep for media, but I am never the one in front of the camera. I'm always behind the scenes.
So all the more reason this is so much fun.
Yeah.
So for those of our coworkers that don't have the pleasure of seeing your work or understanding what it is you're doing, so how would you describe kind of your role here at Parkview?
Yeah, so I often tell people I handle all things news media. And I usually differentiate by saying news media because we have a separate team that handles social media. And sometimes those overlap often, but we do have an incredible team that handles those channels as well. So when I'm talking about news media, I generally am writing press releases, coordinating interviews, photo shoots, filming, or responding to questions with statements and things like that. And you could really sum it all up by saying that I'm just telling stories. I'm telling Parkview stories in the news every day.
Yeah, that's really powerful. And they're powerful stories.
Yes.
So what makes a good story?
So I would say 3 things make a good story. First of all, it needs to be timely. So in the news, obviously, we're talking about current events. So you want to relate to things that are currently happening either locally or in the world. The second thing that makes a good story is that it's impactful, and when I say that, it means it affects a lot of people. If it's only impacting a small group, it might not be as big of a story or as widely covered in the news. And then the third thing is that it's compelling. And usually when we talk about being compelling, it's got a human element to it. For us, that human element usually comes from patient stories, right? It's not always easy to get a patient story, to find one that's really good, and to have a patient who's willing to get in front of the camera and tell that story, but when we do, it's magical.
Oh, magical is absolutely the right word. I've seen some of those videos and some of the writings, and just seeing the words and reading them, I think you can absolutely get an idea of what it's like to have care delivered by Parkview or being a member of the Parkview family, certainly.
Absolutely.
So you were highlighted recently, you and the communications team, by the Public Relations Society of America. And it was an award, and I know it's not always about the awards, but can you brag a little bit about what the award was and certainly the efforts that were behind it? Because it was related to our COVID coverage, is that correct?
Correct. So actually we got 2 awards, so I will brag a little bit
Yes.
there. The first we got from the Public Relations Society of America, or PRSA, for a regional award called the Diamond Award. And so we entered with our media relations efforts surrounding the vaccine clinic and education on vaccines in general. And we won that award last year, which was super exciting in itself. And then Jessica Four, who's my leader, was like, I think we should enter this in the national awards. And I was just still in shock that we got the first one. But I was like, all right, if you really think so. And we did. And we found out we got on the short list and invited to the reception in New York City, which she was able to attend for us. And we won, I believe it's called the Award of Commendation for the Bronze Anvil Awards, which is essentially first runner-up for our category, which was media relations for nonprofits.
Wow,
Yeah.
that is amazing. And if I can just say, the Diamond Award and the winning that certainly seems appropriate given our
Right.
given our diamond.
Absolutely.
Love that's wonderful. And I know there's a team of people certainly that are all involved in the efforts to bring forward all that coverage. I mean, it was obviously not just local, but we had several regional and national stories when we were putting out information on whether it's vaccines or our infusion clinics or just simply, masking, and the very beginning hand washing. I mean, some of those things went very viral. So applaud certainly you. Congratulations to you and the team
Thank you.
on that. So why was the recognition meaningful to you?
I think it's meaningful for me in a few different ways. Both of these awards bring up a really big range of emotion. Obviously, first of all, I'm excited. And like you said, it's a reflection of the work of our entire team, right? And I'm just glad that our media relations efforts were able to reflect what was happening here at the Miro Center in the vaccine clinic, out in the communities with the mobile clinics they were doing, the education people were providing. That's a big win, number one, is that we were able to showcase what everyone was doing here. So very proud of that. On the other hand, I told you I didn't think I could talk about this without also acknowledging that it was a very stressful time for me. And all the work that went into it kind of took a toll on my mental health. And I felt that, it's not fair to talk about the accolades without talking about the struggle. And so for me, looking back, now I can kind of recognize that last year about this time, we were coming off the initial opening of the clinic and all the vaccine age groups. And so I think the adrenaline literally wore off a little bit, and I kind of had to deal with the mental, emotional effects of what was left. And I hadn't done a good job taking care of myself during that time, and finally decided to seek some help. And so for the last year, I've just really been on a different journey with taking care of my mental health at work, at home, all around.
I mean, I applaud you. I know that so many of our coworkers appreciate kind of the authenticity of that message, because I think the last several years we've all seen it, we've all felt it in very different ways, and experienced it both at work but certainly at home. And there's not a one size fits all in terms of how to work through some of that. And that we certainly recognized in the very beginning of the pandemic, and really layering on the feedback we were getting from our coworkers and our leaders. What are the right resources and support that we can put out there? And that changed over time, certainly over several years, but certainly underscoring that we all know that well-being is not a one-size-fits-all. It has to really be authentic for you and personalized for each individual person, but certainly important for everyone to find the best ways to take care of themselves. Are there any of the resources that Parkview had provided, because we have so many coworker support resources out there, are there any that you found more valuable than others, and kind of as you reached into them?
Yeah, so I had to think about this a little bit because it changed as time went on, right? As you said, that as the pandemic went forward, we kind of shifted to adjust to what we thought people needed. I really loved the Calm app in the beginning, did some meditations, however, didn't stick with me for very long. I've learned that I'm more meditative if I go on a long walk or a long run rather than just sitting in one place. But, and I think they have options for that as well. So whatever works for you there. And then for me, EAP was really a changing point. And I think the reason is because it allowed me to just find the direction I needed to keep going. So EAP is meant to be a short-term solution if you've never used it before. And I think what it really did for me was help me figure out, what exactly am I dealing with? What are some of the root causes here? Because I didn't necessarily know what to solve. I didn't know exactly how to fix it, and I didn't know those next steps. And I think that can be really scary for people in itself, because we feel like we always have to have the next answer. But you don't have to have the answer. You can just say, I don't know how to change, but I don't want this anymore. And so for me, EAP was that resource to say, okay, what's going on? How can we move you ahead? And I'm really glad I took advantage of the referrals to additional resources within Parkview that were very helpful to me. And I can't say enough, really connected with my counselor at EAP. You know, when you have that connection with someone who can really lead you in the right direction, and I was able to just keep going and down that path.
That's great. I mean, they say that everyone should have an advisory board of people all around you, and just being able to tap into and have thought partners and or be able to vent sometimes, or just be able to, you know, have honest conversation with. And so, you know, who that advisory board is for everyone, you know, who you laugh with and who you cry with and who you know, really just have to be someone who listens.
Yeah, and she was someone who knew what was going on at Parkview, but obviously didn't know me, so could be very unbiased in listening to my story and, you know, getting me on the right direction. So that was very helpful.
Well, thank you for being a part of the podcast today. I mean, number one, I think we can talk a lot about the work that you and the team and the awards, which I'm so glad we were able to kind of sneak in there. But you carry the voice of Parkview every day in what you do. And you have that frontline access to so many outlets, whether it be print or whether it be media, and they're all reaching into you as that trusted resource. So thank you for your work and really being able to truly tell the Parkview story every day.
Oh, thank you. I take that responsibility very seriously, and so I was very glad that you were receptive today to have the conversation about mental health, because I know a lot of coworkers don't get the same voice or the same opportunity, and I feel very privileged to be able to have this access to share my story, but I know there's so many other stories out there that are really important, and hope we can continue to tell them.
Well, I'm glad you did, and quite frankly, some of the suggestions from after our last podcast were to touch on mental health. So it really fit in well, and it was great feedback that we heard from our coworkers saying that's a topic that they want to hear more about, and also just understanding what all the resources are from Parkview. So thank you. That ended up really being able to, I think, highlight for coworkers, you know, we're all in that same boat.
Absolutely.
And certainly being able to talk about those resources and finding what works best for you is key.
Yes, and there's no shame in asking for help and getting help and seeking all those options. Everyone has hard times, and those resources are meant for you to use them.
That's great. That's great. Well, thanks for joining us.
Thank you for having me.
So one of the things we talked about earlier was the Parkview support resources for mental health, and just really being able to access all in one place, all the things that we're offering for our coworkers. And so there's an easy place to see that on Pulse under the resources and tools page, going right to coworker support resources. So if you haven't checked that out, that would be a great thing to go out there and just see what is out there and options for you to engage in perhaps different ways than you are today. So thank you for joining us today for another episode of Parkview Connections. Again, appreciate all the suggestions coming in and the feedback on future episodes and guests, and certainly the topics that are most meaningful to you. So as a reminder, you can submit your questions and your topics. You can send that to me via email, or there's a link on the Parkview Pulse page as well. Thanks for joining us today.